Cheap Cosmetic Dentist UK underline. Normally, most people think of cosmetic dentistry as very expensive and only for the very rich, full stop. Although cosmetic dentistry normally does cost more than routine dental treatment, it doesn't necessarily mean that it always will be very expensive and that you will not be able to afford it, full stop. Fortunately, there are certain ways in which you can knock off up to 50% or even more of the cost of having cosmetic dentistry, full stop. So in this article we have highlighted 8 methods in which you can knock off at least or up to 50% of any cosmetic dentistry, full stop. Number 1. Shop around in the UK, underline. You can guarantee that from the place of your work or from your home, there will be at least 10 dental practices within fairly easy driving distance, full stop. Obviously not all of these dental practices will be carrying out cosmetic dentistry, but at least 3 or 4 of these may be ones that you want to perhaps go to have cosmetic dentistry carried out, full stop. Look at our link on cosmetic dentistry, which will also show you how to find the right dentist and the right dental practice for your cosmetic dentistry, full stop. We always say that you should choose at least 5 different dental practices before you choose the definitive one for your cosmetic dentistry, full stop. If possible, ask family or friends or work colleagues if they have had cosmetic dentistry carried out and who they used and would they recommend them, full stop. The other place is obviously websites, full stop. Websites can be very deceptive, so you should choose a range of websites before you choose your cosmetic dentist, full stop. Some of the best cosmetic dentists that I know do not have the all singing, all dancing, no expenses spared website, full stop. The reason for this is that these dentists are really good at what they do and they don't need any more patients than the ones they already have coming in, So that's the reason why they haven't invested endless amounts on their websites, full stop. On the other hand, you can have that all singing, all dancing, snazzy website, but that is just a false front underneath, where that dental practice may be just an average dental practice who just as recently decided to jump on the bandwagon of becoming a cosmetic dentistry practice, full stop. Number 2, shop around, full stop, underline. Obviously, once you have been to a cosmetic dentist, you will have got a treatment plan and you will know how much your treatment will cost, full stop. By shopping around, you will notice that there could be a considerable difference in the range of treatments and the options you have been given, full stop. Even with a treatment that is carried out commonly, such as tooth whitening, the prices can vary hugely, full stop. This is because one dentist prefers a particular brand of tooth whitening and another dentist prefers a different method of tooth whitening, full stop. They may both give the same results, but the costs of providing a particular brand of tooth whitening can vary, full stop. So the moral of the story is that you should always shop around, full stop. You can also possibly think about going abroad for your dental treatment, although we don't recommend having treatment abroad as a general rule, full stop. Number 3, ask for discounts, full stop, underline. Once you have a treatment plan and you have decided to use a particular dental practice and a particular dentist for your cosmetic treatment, that final price may not be the, in inverted commas, final, full stop. There is absolutely no harm in asking the dentist for a discount, full stop. Before you ask the dentist for a discount, it is probably better to speak to the practice manager instead, full stop. Here is some inside information, full stop. A practice manager will have or give you more leeway to a discount than the dentist, full stop. A dentist will just simply, out of principle, will often refuse a discount, but the practice manager who has targets and deadlines, will be more amenable to giving you a discount, full stop. Number 4, negotiate a payment up front, full stop, underline. Cosmetic dentistry will often take place over more than one visit, but if you offered to pay the cost of the full treatment up front, that may be something that the dental practice is interested in and which may attract some discount for you, full stop. Any amount of discount is better than no discount, full stop. The amount of discount can vary from 5% to perhaps 20%, full stop. Number 5, cash only, full stop, underline. Most patients will pay for cosmetic dental treatment with their bank or credit cards, as nowadays nobody uses checks, and in any case checks cannot always be honoured, full stop. The other alternative you do have is cash, full stop. However, if you offer to pay by cash, and the dental practice is part of a large corporate group, then cash will not really be beneficial to the practice, full stop. On the other hand, if you went to a dental practice where the dentist is the actual owner, he knows that cash will be better than having payment by credit card, full stop. You can read between the lines, that cash could be advantageous for the dental practice owner by up to 40%, full stop. So there is always no harm in asking the dentist if you can have a discount if you paid by cash only, full stop. Number 6, further negotiation skills, full stop, underline. If the dentist or the practice manager refuses to budge over any discount, you can always play the inverted commas extra family member card, full stop. You could always entice the dental practice to give you a discount by saying that you have a family member or a friend or your children who will also register if you are given a discount, full stop. All dental practices need new patients, so this could be a useful bargaining tool for you to get that discount, full stop. Number 7. Appointments at short notice, full stop, underline. Another negotiation tactic is to make the practice aware that you can attend an appointment at short notice, full stop. All dental practices will have patients who need to cancel at the last minute, or they suddenly find a big gap in their appointment books, full stop. You can make the dental practice aware that if you are given a discount, you can attend and fill that sudden gap in their appointment book, full stop. There is nothing worse for a dentist than having to fill in a big gap in the appointment book at short notice, full stop. Obviously you have to then make yourself available if the dentist did ring you at short notice, full stop. Number 8. Treatment phases, full stop, underline. Don't forget that cosmetic dental treatment is usually carried out over more than one visit, and if after using all the above tactics you are still struggling to pay the amount quoted, you can always ask your treatment to be carried out in phases, full stop. We have lots of patients who, as an example, need tooth whitening, veneers and white fillings, full stop. When treatment is done under phases, the tooth whitening can be carried out first, full stop. Then after a break of 2 or 3 months, the veneers can be placed, full stop. After another few months, the white cosmetic fillings can be carried out and even these can be done in phases. In this way, you're not having all the treatment done in one go, and the payments will be much easier to manage, full stop.